that vote justice stand part of the schedules. Those of that opinion will please say aye. Aye. To the contrary, no. The ayes have it. Honourable members, the question now is that vote health stand part of the schedules.
Mr Chairman.
I call the Honourable Annette King.
Mr Chairman, can I first of all say how much I enjoyed Scott Simpson's speech, because he did talk to the estimates and he did talk to achievement, and he didn't go into a mad rant and rave and personal abuse of the opposition. That man should be a minister. But he made one mistake. It's not Team Key or Team Justice. It's Team Toadies. That's what they are. Team Toadies. A whole lot of toadies, all bowing and scraping to Mr Key. But I want to talk about the health estimates, 2014-2015, and I want to talk in these estimates about the health workforce. Because our health workforce and the cost of our health system is made up by our health workforce. About 80% of the costs of health comes from our health workforce, those who provide our health services. And just recently, health workers in New Zealand were offered a 0.7% pay increase. 7.0. It was 0.7% pay increase. They are rather upset about that because our health workforce believe they are competent, they are quality, they are professional and providing incredibly good health services to the people of New Zealand, and I agree with them. But you have to ask why such a small increase has been offered to a health workforce. It is because the truth is, Mr Chairman, the health budget has been reduced in real terms. Now, the members don't like to hear this, but before they say I'm wrong, I suggest they read the budget documents. The health budget was reduced in real terms by 2.3%. They're Treasury figures, they're in the budget document. But worse than that, go on and look at the graphs in the document, in the budget documents, and Treasury are saying that in 2015-16, health will be reduced by 3.7% in real terms. In 16-17, that'll be reduced by 3.6% in real terms, and 17-18 financial year by 3.1%. So we have a pathway for health under a national government of year on year of cuts in real terms. So I'm saying to the health workforce of New Zealand, it's going to be a rocky road should this government be re-elected, and it's going to be a rocky road for New Zealanders receiving health services, because we are facing some huge health workforce shortages. And I draw attention to members opposite to the Ministry of Health's report that they put out just last week. And they are warning that there will be a serious shortage of cancer specialists looming in this country. They've said that the number over the next decade, that cancer in New Zealand is going to increase by almost a third. And by 2022, there will be a shortfall of 7 radiation oncologists, 30 medical physicists, and 25 radiation therapists. They said that there were only 3 trained in New Zealand, and 6 of them, we would need 6 in every year to cope with the demand over the next 10 years. They said since 2009, 6 of the 13 medical physicist graduates had gone straight overseas. They said they've been warning of this problem since 2012. And what we do know about a health workforce, it takes time to train them. You just can't pluck them out of the air, and there is an international shortage of a cancer health workforce. And what I say to the Minister of Health is, can we not learn from the past? And I've had to listen to the Minister of Health say how under a Labor government, cancer patients had to be sent to Australia. Can I tell the members opposite, it was one of the first decisions I had to make as Minister of Health was to approve sending patients to Australia in early 2000, Mr. Chairman.
Honourable Annette.
Early 2000. Why? Not because of anything a Labor government had done, but because report after report on health workforce had been provided in the 1990s to the previous government about the shortage of radiation therapists, that we weren't training enough, that we had ageing linear accelerators, that we needed to take this issue seriously. We did not. And it wasn't until 2000, when we increased the number of radiation therapists, take 3 years to train, that we started to buy new linear accelerators, that we were able to start to cope with our own treatment of cancer. And I'm saying, why haven't we learnt? Why did we not look ahead and see what was happening? We're now told that we are facing a serious nursing shortage in New Zealand. A serious nursing shortage, not a serious doctor shortage. Shortage of GPs, yes, but not a shortage of doctors overall, and there is going to be a surplus out of Australia anyway. But we face a serious nursing shortage, and we're told we should have started providing for that in 2012. I have to say that I am really disappointed in Health Workforce New Zealand, because we were told they were going to be the organisation that would solve all our problems for our health workforce. And I have to say they've come up pretty much with a lemon, because there has been no serious decisions are made around our nursing workforce, still deciding on that. There's been no serious decisions made about how we're going to be able to offer cancer services going forward. But I have to tell you, Mr. Chairman, this is an organisation that is costing taxpayers an awful lot of money for a few pieces of paper and some ideas about physician assistants, some American idea that they wanted to try, when we ought to be building our health workforce and training them and upskilling them here in New Zealand. I was staggered to read that over the last 5 years, the chair of Health Workforce New Zealand has been paid $743,138 in fees and in reimbursements. $743,138. The chair of Health Workforce New Zealand is paid $13,000 a month. And our senior citizens, a single superannuitant or old veteran, is paid $19,000 a year. So we are paying all this money for an executive chairman of an organisation that is not addressing the health workforce issues this country faces. Serious issues. I haven't even talked about what's called the unregulated workforce, the place where most of our healthcare is provided in the home and in the community for our older people. Almost no work has been done by Healthcare of New Zealand on that issue. It's not good enough, Mr. Chairman, and I think it's time that we took health workforce issues seriously, because we do have highly competent, highly trained, quality health workers in New Zealand that we need to value. But we won't if we underpay them, that we do not value them, and they are overworked and stressed because there's not enough of them. And unfortunately, that is the picture that is emerging under Minister Ryle. And so I'd like to put to rest once and for all this nonsense that a Labor government left a shortage of a workforce. We were the first government in living memory to try and address the health workforce by increasing the number of doctors. First increase in the number of doctors training was in 1981, till we became the government. that we increase the number of radiation therapists, nurses, nurse practitioners, and many others, including dental therapists, my own old profession, because we took health workforce seriously. That has not been what has happened under this government. So if we are facing, according to Treasury, year-on-year cuts in health budget under a national government, the ability to pay and hold that health workforce will diminish year on year. And once again, we will be forced to send people to another country.
I call
Mr. Chair.
Honourable Member Barbara Stewart.
Thank you, Mr. Chair. Thank you, Mr. Chair.